Hello everybody. I want to talk with you about a new government website, HealthCare.gov. It's a good resource for understanding what the federal government needs you to believe about this new law. For the first time ever, the federal government will decide all your insurance options, public and private, in one place. Let me show you how it works. Now, I have pretty good health care these days, but let's roll the clock forward a few years to when I'll have to get coverage under Obamacare. From the home page, I choose my state, then answer a few more questions. I might learn whether I get a Cornhusker kickback, Florida flim flam, Louisiana purchase, or any other special deal that my politicians negotiated behind closed doors. Based on my choices, the system has returned options. The first points out that I may be eligible for health insurance that comes with a job, but I'm not going to count on that. Anyone who earns less than $80,000 a year will likely lose employer-based benefits, and only half of current plans will be grandfathered in 2013. The second option is to explore the market for individual insurance options in my area. So let's try that. I'll plug in my Chicago zip code, and it shows me all available private plans. This fall, there will be even more details, because we're hiring 700 new federal bureaucrats to write thousands of pages of regulations, which you and your employer and your state's insurance commissioner will have to obey as we continue to implement this law. That's why we passed this reform, to help Americans understand the consequences of putting the federal government in charge of their health care. Americans like Harry, a senior citizen in Nevada. On July 21st, Harry wrote a letter to the Secretary of Health and Human Services describing his anxieties after learning that Medicare will cut reimbursements to hospitals in his state. His anxiety is understandable. Harry's a politician running for re-election to the U.S. Senate. Make no mistake, Harry should have read the bill before he voted for it. By 2014, those 700 new federal bureaucrats will have written most of the regulations that politicians like Harry Reid should have anticipated. But right now, Harry can use the finder I showed you to learn about the almost $500 billion we're cutting for Medicare. You can see that the Affordable Care Act has banned lifetime caps and stopped insurance companies from denying coverage to children with pre-existing conditions. That's why many insurance companies have said they won't offer child-only coverage anymore. No matter your age or situation, there's something for you at HealthCare.gov. So take a moment and check it out. Actually, you have to. That's in the law too. Thanks.